February is Heart Month, and the Centers for Disease Control and Prevention says that heart disease is the leading cause of death in the United States for men and women. And Dr. Hoyle, a Novant Health cardiologist, is here to talk about heart disease and how to prevent it. As always, so glad to see you.
Glad to see you. Thank you for having me.
All right, let's start talking about the big one. What is heart disease?
Well, heart disease encompasses a whole variety of diagnoses that can affect men and women. Most commonly, coronary artery disease, which I think of as blockages or fatty buildup in the blood supply to the heart. But we can also have disorders of the heart's electrical system or the heart's valvular system as well, the valves in the heart. They get more common as we get older, and what we're learning now is that men and women probably have a similar risk for both types of illnesses.
All right, so now who is most at risk, and is it genetic?
To a certain extent, genes play a role. There are other modifiable risk factors that we do that put us at higher risk. Most commonly smoking, diabetes, obesity, but as you mentioned, family history also plays a role.
So what kinds of things can we do to kind of minimize our risks?
Minimizing risk is something that we all try to do, and it's important to be mindful of the fact that there's only so much we can do to reduce our own risk. However, I think eating a sensible diet, high in fruit and vegetable content, avoiding smoking, exercising if it's okay from the standpoint of the patient and their doctor, is an important way to improve our cardiovascular risk.
And what do, I hear a lot about, taking an aspirin. So is that something that can save you?
Well, I think that it's controversial. I think we've moved in our field from saying that everybody should be on aspirin no matter what, to saying that aspirin probably benefits those with the most risk factors. So the bottom line is always check with your doctor before starting any new medication, even one available over the counter. But in people who have high risk for coronary disease, things like family history, diabetes, tobacco use, or previous heart problems, those people should probably speak directly to their physician about potentially starting an aspirin for prevention.
All right.
But everybody's a little bit different in terms of risk.
And where can people learn more information?
Well, the American Heart Association has a wonderful website, heart.org. We can also be available at Novant Health, Winston-Salem Cardiology, as well as the Centers for Disease Control. All of those sites have good information and are good topics for information.
All right, good deal. Thank you so much. We appreciate it.
Thank you.